feel great. I'm not tired, I have energy, and that isn't something that I could have said before I got my pacemaker.
Jessika is funny, very smart. I knew right off the bat that she was going to be a great nurse just based on even the first week that I had her.
Jessika, she's very outgoing. She has a lot of drive in her. So once she puts her mind to something, it's going to get done no matter what. She's loving and caring.
I always had really bad fatigue. I started to notice it a lot more, like chest pain. I would have heart palpitations.
There's days where we had plans and she just was super tired and couldn't really do much. Even if we go on walks, we'd have to take breaks because she wouldn't be able to catch her breath.
It was 2 o'clock in the morning. I was at work and I started having really bad chest pain. And Alexis was like, that's not good. You should get that checked out.
She had been complaining of chest discomfort, and after a bit, I'm like, let's hook up to the monitor and see what's going on. I remember seeing on the monitor, it was just doing all kinds of different rhythms and extra beats. And I'm like, you should probably go down to the ER.
I went down to the ER and they did the basics. They did the EKG, the labs, all of that. They decided to admit me because my rhythm wasn't normal, but after about 12 hours, they decided that it wasn't super concerning, so they sent me home. So that's when I had to go and get another referral. My pacemaker was presented to me right before I went into surgery. I got my pacemaker August of 2023. My doctor described the pacemaker as a device that would sit under the skin, and it has 2 leads that go into your heart. One of the specific leads that I have is the conduction pacing lead. That was one of the best ways that my doctors came up with in terms of preserving the natural heartbeat while also providing the type of pacing that was best for my situation. Having the conduction system pacing is actually a lot more reassuring, just knowing that the advancements that have been made in conduction system pacing is a lot more evolving than what it was previously. So it's comforting knowing that I have something that is continuing to grow. After I got my pacemaker, I had 4 to 6 weeks of recovery, and after that, they told me to live life how I normally would.
She got up, back and moving, active very quickly. You could see the energy and how more active she was throughout the days. And the motivation was there as well.
Getting the pacemaker helped decrease a lot of the symptoms that I was having, and it also gave me the peace of mind that my heart block wasn't going to progress into something that was potentially fatal. My conduction system pacing helped improve my life.
The pacemaker let her return back to life the way that we wanted to live life and how we wanted to continue our lives afterwards. We go out hiking with the dogs or training them. Train them in agility, dog diving, barn hunting.
In the beginning, I did not want the pacemaker because I am so young. I thought that since I was young, I didn't need any of that. Now that I have one, I think that a pacemaker is something that should not be looked down on, and anybody of any age could use a pacemaker if it's ultimately gonna improve your outcomes and your health.
I have heard her talk to her patients that are getting a pacemaker and relate to them that way. And I think sometimes that makes patients feel a little bit better. And then just being able to really relate to the patient puts the patient relation on a whole nother level.
I am grateful that I have one. It's made things a lot easier, just giving me a little bit more peace of mind knowing that at the end of the day, I'll always have something that is helping my heart.